Our conversation with State Senator Joe Pittman is brought to you this morning by Marcus & Mack, a law firm representing injured people. Senator, good morning.
Todd, good morning.
It's good to have you with us here today, and we talked with Representative Struzzi earlier about what went on in Harrisburg this week. From your perspective in the Senate, I would guess much the same. A lot of hard work going into getting the state's economy rolling again and some frustration along the way.
Yeah, it's look, Todd, the last 6 weeks in our nation in particular have been extremely frustrating. And as time goes on, the frustration continues to build. And we see the calamity that's occurring around us as a consequence of trying to slow the spread of COVID-19, which I think is something we absolutely must do. We must be very conscious about that. But it's been clear over the last week, at least in Pennsylvania and particularly in western Pennsylvania, that the curve has flattened. We are making progress. And nobody suggests that tomorrow we should turn the light switch on and return to the way things were. But we have to start coming up with a coordinated and thoughtful plan to begin reopening the economy. And we've been really frustrated with the governor's lack of communication with the legislature on how we can do that. And so we've decided to try to accelerate the conversation by passing some common sense legislation that would help engage the governor and his advisors on how we can move forward.
Governor doesn't seem to have much interest in that, though. He has promised he's going to veto the legislation that has gone his way and really hasn't responded from an administration standpoint to some of the biggest frustrations, which are the inconsistencies in what's essential, what's non-essential. Why is this one able to open, but that one isn't when they offer the same sorts of services?
And that has been the most mind-numbing part of all of this. There's no question these are unprecedented times, and the governor has a full plate in front of him. And I don't envy being in his position. But at the same time, we have been an outlier compared to the rest of the nation on so many things, whether it's allowing auto dealerships to be open, whether it's allowing for construction of projects to continue, things such as golf courses. Yet we open up fishing season, and we don't allow golf courses to be open. The inconsistencies are massive. The process that was set forward by this waiver process has been anything but transparent. It's totally lacking in due process. There's no known criteria for how the waivers are provided, and there's tens of thousands of them still sitting on DCD's desk that have yet to be answered. And so it has been a failed process. I think everybody recognizes that. The question is, how do we do better? How do we unwind it? And how do we get the public answers that, as the days go on, they're increasingly expecting from all of us?
So in the legislature this week, some bills did actually fly through both chambers and made it to the governor's desk. Some, at least one that I can think of, still awaiting some reconciliation between the two chambers. Tell me about what you've done this week and what the hopes were for those, and if you have to regroup now on a couple of them.
Yeah, the two bills that we passed this week, one was to require the governor to set up a consistent process of business operation through the CDC guidelines and recommendations. This is something that a majority of the states are using across the nation. It's consistent, it's known, it's transparent, and it's very clear to the public what the rules of the road are. That's the bill that is on his desk that he has indicated that he will veto. The second bill that we passed, which the House will need to act on next week, is to give the counties more authority and opportunity to make some decisions locally. The stay-at-home orders and the other orders put in place, even the school closures, were not necessarily done uniformly. The governor put them in place in a phased approach because the reality is this virus is not impacting the Commonwealth equally across the state. So it makes sense to allow communities to look at this locally, to understand what the impacts are, and to determine if there are ways to open certain segments of the economy while still protecting the most vulnerable citizens among us. And I think that's one of the important things that we have to start to appreciate. The last 6 weeks of testing and data have given us a much better understanding of not only where the hot spots of this virus are, but also the most vulnerable among us. And sadly, very tragically, the Secretary of Health has begun to point out over the last 2 days that over half of the deaths that have been resulted or associated with COVID-19 are coming out of nursing homes. And that is a horrific thing to imagine, and I think it illustrates to us as policymakers that we need to redouble our efforts to prevent this from affecting the most vulnerable in our society. But at the same time, reevaluating the impacts of the closures in so many other ways that aren't just an economic calamity, but they are a social calamity. The social services that we have in our community that we rely on, everything from children and youth services to domestic violence to food banks, are strained to the max as a result of this, and it's causing a lot of ripples throughout the community.
You have talked, and Representative Struzzi did as well, about some specific industries, construction being one of them, the car dealerships, and the ability to conduct business as an automobile dealership makes absolutely no sense to me, and there are a bunch of people in that boat. We've seen, as I said to Representative Struzzi, we've seen other states that are doing it entirely differently than Pennsylvania is and doing it safely, either through online sales or a combination of online sales and meeting by appointment only. And there are some states where you can go out onto the lot as a customer, and if you wish to come in and talk to a salesperson, you can, but they can't approach you out on the lot. There seem to be like there are measures that can be taken to get car dealerships working again, and people need cars. Eventually they do break down, and you can't be repairing them.
You're absolutely right. I mean, we're talking about people who need vehicles to get to doctor appointments, to get to a life-sustaining job, to essential work. We have people who have car leases expiring. Those need dealt with in a timely manner. You're absolutely right. There are businesses and employers out there who have historically had a small amount of traffic coming in and out of their facilities that they could manage social distancing protocols in a way that would allow them to safely operate. But then on the flip side, there we have our big box stores open for business. Until recently, they weren't restricting any traffic whatsoever. And in fact, just a few weeks ago, one of our big box stores was advertising a Black Friday spring sale, almost inviting people and enticing them to come into the store. There's no logic or rhyme or reason to this, and that's where the frustration is occurring. The most common calls that we're getting in our office right now are the frustrations with trying to get unemployment claims filed. We have had over 1.2 million claims filed. And as I've consistently said, the best way to resolve that issue is to get people back to work. And that's where we need to start to focus, particularly over the next 2 weeks as we see the data continue to come in. If the trends continue the way they are going over the last week, it's time to have that serious conversation over the next 2 weeks about how we can begin to open in a strategic and phased way that still protects public health.
Governor has said that he's still not interested in opening up the state for business again. He's sort of planted his feet, and nobody can push him off of that stance. So what are the next steps that you anticipate for the Senate, for the legislature as a whole?
Our next steps are to continue to do what we're doing and try to engage him in the conversation. Again, I don't think anybody is suggesting that we need to walk out the door on Monday morning and return to life as we knew it prior to March 13th. What we're saying is the numbers are improving. We need to, over the next couple weeks, take a serious look at whether or not we can begin to open our economy at the beginning of May in a phased and orderly approach. We have the state of Ohio saying they're going to begin opening on May 1st. We have the state of New York saying they're going to extend to May 15th. Here we are stuck in the middle, so to speak. Perhaps we need to talk about a regional approach to this, because we are seeing much different numbers from western PA to southeastern PA in terms of the growth and the capacity of our hospital systems. And I think that's one last point I need to make, Todd. When we started the social distancing effort, rightfully so, we were focused on flattening the curve. And we were focused on flattening the curve to ensure that our healthcare system did not become overwhelmed. And one consistent point of data throughout the last 3 weeks is that in our hospital system statewide, we have over 70% of our ventilators still available. We have nearly 50% of our hospital beds available. We have approximately 40% of our ICU beds available. So we have ensured that from a facilities perspective, our healthcare system has more than held the line on the hospitalizations and the unfortunate deaths that have occurred since this outbreak began. My concern is with the employees, with the fatigue, with the mental exhaustion, and now what we're seeing are healthcare systems, which I think you reported just this morning, having massive layoffs of employees because all other procedures and all other surgeries have been stopped. And in some respects, we have empty healthcare facilities right now.
Yeah, Penn Highlands let 600 people go. 5 different hospitals, a total of 600 people, they had to send home because they're not doing business anymore.
Wow.
So, it's an amazing thing, and we're continuing to watch it. Senator, anything else folks need to know this morning about what they can do in order to sort of push this situation along?
Well, obviously, as we talked a month ago, Todd, we need to try to be patient and calm. And I have to tell you that over the last 30 days, I am sensing a real level of frustration on many levels, and rightfully so. We're going to work very hard to get us through this in an orderly way. We need to try to be as conscious of our movements and our activities and our exposure to others as we possibly can be. A lot of this is common sense. Practice good hygiene, maintain common sense social distancing, recognize those among us who are most vulnerable, and the most vulnerable among us need to recognize their vulnerability. And that's how we're going to have to do this. We're going to have to work together. We're going to have to be patient. And it's been very difficult with our current governor to work with him. But we're trying to do that in the best way possible to bring the balance we all need into this crisis.
Well, Senator, the work goes on. Thanks for spending some time with us this morning. We appreciate it.
Todd, thank you.
Have a great day.
All right, you hang in there.
All right, you too. It is the voice of Indiana County, WCCS, AM 1160 and 101.1 F.